The extraction of a single-rooted tooth, or a simple extraction, is the most common dental extraction. During the extraction procedure, it's important to place your thumb and forefinger of your non-operating hand firmly on both sides of the alveolus, immediately adjacent to the tooth to be extracted. This firm grip protects the delicate surrounding soft tissue should your instrument slip, and helps to maintain the integrity of the buccal plate of bone under the force of the extraction. Using the dental elevator, curette, or number 15 blade, sever the epithelial attachment around the tooth. The instrument is placed within the sulcus. The instrument is then forced to the bone circumferentially to break this attachment. The elevator, held like a screwdriver, is placed first on the mesial aspect of the tooth. Remembering to conform to the tapered anatomy of the root, slide the elevator firmly within the sulcus toward the apex of the root. Rotate the elevator while exerting downward pressure in an apical direction to cause the tooth to move toward the buccal or labial from its present position. The function of the elevator is to luxate the tooth and sever the periodontal ligament. At all times, remember to hold the alveolus firmly with your non-operating hand. Then, place the elevator on the distal aspect of the tooth and rotate it to force the tooth out toward the buccal position. Repeat the application of the elevator on the mesial or cranial aspect of the tooth and distal or caudal aspect of the tooth until the tooth is mobile. When the tooth is mobile enough that you feel you could almost lift it out with your fingers, it's then time to apply the dental forceps. Choose a forceps to fit the size and shape of the tooth. Ideally, you should choose a forceps with maximum surface contact at the tooth-beak interface. Hold the forceps like a pair of pliers. Place the forceps with the long axis of the beak and the long axis of the tooth aligned. Slide the beaks of the forceps apically along the root of the tooth until firm resistance is met. Before any movement occurs, make sure you have secure purchase of the tooth as far apically as possible. The correct placement of your non-operating thumb and forefinger are critical at this time. Use the forceps to slowly move the tooth toward the buccal aspect with pressure toward the apex of the root. Then, with a very slow pendulum-type motion, move the tooth lingually while continuing apical pressure. Any rapid movement or excessive force at this time will fracture the root of the tooth. Once the tooth is moving freely, merely rotate and lift. Before setting the forceps down, carefully dry the root end of the tooth with a 2x2 sponge. Examine the ends of the roots for fractured root tips. If the root tip looks rough and rounded, you have successfully removed all of the tooth. If the root tip looks sharp or irregular, like broken glass, you probably have left part of the root in the socket. Tease out fractured root tips with a root tip pick. Match up the pieces to make certain the entire tooth is removed. Complete removal of the tooth can be confirmed with radiography if there is a question. After the tooth is removed, compress the alveolar plates of bone to reduce the wound site. Usually no sutures are necessary following a simple extraction.